Social medicine and community health. Good afternoon, everybody. Today we will be talking again on the healthcare delivery system, but we are going to emphasize and we are going to start this whole series with by knowing how healthcare is delivered right from the center to the periphery. Today's lecture will consider important aspects of healthcare delivery system in India at the center level. Now, as usual, one must pay regards to the development team under the principal investigator, Professor C.P. Mishra of Institute of Medical Sciences, and his excellent team from Aligarh Muslim University. What are the learning objectives? Learning objectives are important because when you talk of any medical program or any other healthcare program, first of all, it is important to know what are its components, what is its view, what is the organization, most important, the funding. So therefore, overview of the sectors providing healthcare in India, how is it provided, who provides it, what is the synoptic view of the health system in India, healthcare organization at the district level, and of course at the primary level, and most important, what is the funding, and last of all, what is the healthcare setup and organization, right from the center to the periphery. In introduction, it is important to know that healthcare system actually constitutes the management sector and involves organizational matters. It operates in the context of socio-economic and political framework of the country. The challenges the sector faces are substantial, from the need to reduce mortality rates, improve physical structure, necessity to provide health insurance, and ensuring availability of medical personnel. These are not the only factors. The others are that it must be known that healthcare is one of India's largest service sectors. In India, public and private sector both provide healthcare of primary to tertiary levels to the patients and the community through various kinds of setup. Approximately 70% of the patients are actually getting services from the private sector, while the remaining 30% of the patients are getting services from the government sector. But there is definitely a combination of both private as well as the government sector, and this must be taken into consideration that whatever services be given, it should benefit the public for whom it is meant. In India, it is represented by 5 major sectors or agencies, which are the public health sectors, the private sector, the indigenous system of medicine, the voluntary health agencies, the national health programs. And now let us start one by one. What is the public health sector? Now the public health sector includes the primary health care, the primary health centers, the sub-centers, the hospitals, the health centers, and of course in this the teaching hospitals and the specialist hospitals, they all come in there. Now, the primary health center is mostly at the peripheral level with its sub-centers. Each primary health center catering for nearly a population of about 30,000. And each sub-center is now actually catering to a population of nearly 5,000. And hospitals and the health centers, we have of course the community health centers, which are actually in the rural areas. And at least the area of 3 primary health centers will constitute at least 1 community health center. Then you have the rural hospitals, the district hospitals, the health centers, the specialist hospitals, teaching hospitals. Then we have, of course, the health insurance schemes. And the health insurance state schemes as well as the CGHS, that is, which is mostly in the Central Union territories. And we have other agencies. For example, the railways and the defense services. They have their own pattern of services which are being given. And then most important today, the booming and the mushrooming the private sector, which has the private hospitals, the polyclinics, the nursing homes, the dispensaries, and in which we have the general practitioners and their clinics. And today it is not only their clinics, it is actually the system has changed into big hospitals wherein a lot of doctors combine together to give all sorts of medical care under one roof to make it more convenient for the person who comes in. In this, I would like to mention one more. That is, let us not forget from all this new fangled medicine system which is present in the cities and in the smaller towns, we have still a very important system known as the indigenous system of medicine, which has been coming from centuries old, in which we have four main systems, that is the Ayurveda, the Siddha, Unani, the Tibbi, and the homeopathic, and of course we have the unregistered practitioners, those in fact who have actually learned medicine from their relations or from their parents or from their close friends, and they have been sitting with them and they learn medicine and they start to practice. And then we have the voluntary health agencies, and the last of all, let us not forget the national health program, which actually is started at the center, it's led down to the state, goes right up to the periphery, and it deals with those diseases which need to be either controlled, eliminated, or eradicated. This is important. Now, in the structure and organization, actually under the Indian Constitution, what is important is that health is a state subject. So each state will have its own healthcare delivery system. But nevertheless, we must have a sort of a common system wherein the country is able to develop throughout the whole structure. Certain responsibilities also fall on the central government, namely aspects of policy making and planning, guiding, assisting, evaluating, and coordinating the work of various professional health authorities. Because all the time, without planning and guiding, we cannot actually make mid-course corrections, because these are needed if we want the program to move in a right direction. This is very important. So therefore, and most important, you need funding. So providing funding to implement national program is one of the most important things. Secondly, it's not only funding the national program, it is keeping the national program alive as per its use and effectivity in the country. In the Indian healthcare sector, what we are showing before you is a very beautiful chart diagram, which actually is representing what we have been talking. That is, we have the state hospitals, then we have under the state we have the municipal, the corporation dispensaries, the referral hospitals, then we have the ESI dispensary, let's not forget, because this looks after the labor population, and we have the Ayush dispensaries, which actually cater to all the Ayurvedic, Unani, and the Siddha and the homeopathic. In this Ayush dispensaries, you get a collection of all the Ayurvedic and the ancient systems of medicine and treatment for the people's health. Then you have, starting right from the center, you have, of course, the tertiary care hospitals, for example, the All India Institute of Medical Sciences. Then you have the medical college and the hospitals. Then you have the CGS dispensaries, and you have the district and the hospitals, community health centers, primary health center, the sub-center, and finally at the periphery, you have the peripheral workers known as the ASHA and the auxiliary women workers, and at the field level you have the traditional birth attendants who have been delivering women in the rural areas for a long time, and in fact they were the main stronghold of maternal and child health care in our country. Now it is important to realize that although they have been conducting, they are untrained people basically, and we need to teach them the art of conducting deliveries and referring them at the right time into the main medical system wherein the patient will be safe and her child will be safe. So for this, we started the system of auxiliary nurse midwives, and they were the workers who were actually working in the field level. Then came the ASHA. The ASHA is also a female worker who is working at a 1,000 population at the village level, and all these people are working along hand in hand with the same objective of keeping health alive at the periphery. Now, we have, of course, the Ministry of Defense. Dispensaries, we have their dispensaries, we have the base hospitals, we have the specialty hospitals, and of course, the very famous Army Hospital Medical College. We have one at Pune and at one of the other places. Then you have the Ministry of setup, wherein you have the dispensaries and the hospitals which are also there. Ministry of actually Railways. Railways have their own system and they have their own pattern, they have their own dispensaries, wherein all the workers from the railway system are able to go and get, just for example, all the labor class can go into the ESI dispensary. So the railway population or the group, the railway group, they have their own dispensaries, they have their own hospitals. In fact, talking about Varanasi has one of the most important cancer hospitals as a part of the railway services. Then coming to the private sector, can't forget that. Now, private sector is actually two, either for profit or the non-profit organizations. Now, and for profit, we have the multi-specialty hospitals, the specialty hospitals, the nursing homes. They could be large, they could be small, and the private clinics and the single patient doctor clinics also. Then, of course, we have the charitable trust dispensary and the hospitals which are either religious or non-religious, and we have NGO run clinics and outreach services. And we have actually the charitable trust dispensaries and hospitals, and some of these are connected to ashrams and to religious groups. Some of them are the non-religious groups, but they give services more or less just like the bigger hospitals, but maybe on a smaller scale. Now, it is important to realize that we have a setup which extends right from the national to the peripheral, that is up to the primary health center. We have to see what is essential. Now, starting from the national level, you have the Ministry of Health and Family Welfare. Then you have the states and the union territories. You have the Department of Health and Family Welfare. It has its own setup. And each one, as you go up or you come down the line, is responsible to the senior person for instructions as well as for reporting. At the district level, you have district health organizations, the private sector, the voluntary sectors, and at the sub-district level, of course, you have the community health centers which are catering to a population of nearly 1.5 lakhs. Then you have the primary health center catering to a population of 30,000 approximately. Then you have the village level which takes up a population of nearly 1,000, where you have all peripheral workers at the grassroots level. They are all trained workers. One of the most important workers is the village health guide, who works right at the village as well as at the sub-centers, and he is a trained worker. Then you have the auxiliary nurse midwife, then you have the ASHA worker. So, and you have, of course, let us not forget the TBAs, that is the traditional birth attendants, who we supposedly are non-trained, but now there is definitely a program which is bringing all of them into their training. Now, at the national level, you have the ministry has actually 3 departments. That is the Department of Health and Family Welfare, the Department of Indian System of Medicine and Homeopathy, and the Department of Health Research. So, each of these departments is headed by respective secretaries, and the Department of Health and Family Welfare is supported by a technical wing, the Directorate of General of Health Services, headed by the DGHS, the Director General of Health Services, and in this Ministry of Health and Family Welfare setup, of course, you have the political wing also. That is, it has its own cabinet ministers, then the Minister of State and Deputy Minister. Under him will come all the three, that is the Department of Health with its Secretary of Health, Additional Secretaries, Joint Secretaries, anyway, all that entire setup exists. Then you have the Department of Family Welfare, you have the same, they have their own secretaries, these are of IAS level. And each one is responsible for an intermingling and a proper carrying out of the services and proper instructions right from the state to the, right from the center union to the state and to the primary health centers. Then of course you have the Department of Indian System of Medicine and Homeopathy, you have its own secretary, and you have the joint secretaries, and of course we also have a director for Ayurveda and Siddha systems. Now in the Union Minister of Health and Family Welfare, this is headed by a cabinet minister, a minister of state, and deputy health minister, and it has three departments: that of health, family welfare, and Indian System of Medicine and Homeopathy, headed by the two secretaries, one for health and family welfare and the other for the rest of the two. Now you see, these three departments are equally important in its own function. Health looks after the general health of the public, of each individual. Family welfare, wherein your family planning plus control of the family, bringing up of the children, so MCH, then the bringing up the under 5 nutrition, the adolescent care, all these are important subjects which are to come under these topics. And let us not forget, because there are still some people who want the old system. Even today in our houses, if you remember, you will say that whenever you were small and you had a cold and a cough, the first remedy which was given was by either your nani or your dadi, who said, yes, you must take चाय का तुलसी का काढ़ा या फिर अदरक डाल के. So what is this? This is all Indian system of medicine. And she would also refer to the old homeopathic doctor who would give you nice round pills, which were sweet pills. But these are all important systems of medicine which we are utilizing today, and these have now become actually scientific outreaches of medical care. One for the health, one for the family welfare. Now, the Department of Health is supported by a technical wing that is known as the Director General of Health Services. It is headed by the DGHS. Now, what are the functions? Functions can be of the Union Center, of the state, and let us take the Union List first. Now, in the Union List will come international health relations and administration of port quarantine, administration of central institutes like Central Drug Research Institute, because each and every part of that which matters in health has to be taken care of. Central Vaccine Research Institute, Central Drug Research Institute, and today I must mention that as a part of the drug, there is now what is known as the PVP. It means this is a vigilant service for adverse drug reactions. Now there is a central body which has been started at the center. It is situated in Ghaziabad, and this research institute looks after the entire country's drug reactions, because we must know which are the drugs, because this is how we will know what is the quality of the drugs which are being administered either rightly or wrongly to the patients. And any adverse drug reaction must be reported in time so that proper reactions can be taken or it may be withdrawn if necessary. Now, promotion of research through research centers and other bodies, regulation and development of medical, establishment and maintenance of drug standards, census and collection, publication of other statistical data, immigration and emigration, regulation of labor, coordination with the states and with the other ministries for promotion of health. In the concurrent list, we have actually prevention of extension of communicable disease from one unit to another, prevention of adulteration of foodstuffs, control of drugs and poisons, vital statistics, labor welfare, ports other than the major, economic and social planning, population control and family planning. Now, this concurrent list must move along with the main list of functions which has to be taken care of. Now, in the Department of Health, this is headed by a Secretary to the Government of India as its executive head, assisted by joint secretaries, deputy secretaries and a large administrative staff, and it deals with medical and public health matters, including drugs controls and prevention of food adulteration. Apart from the fact that national programs have to run, in the national programs, the supplies of the medicines, the vaccines, the personnel training, all that has to be, of course, given through these centers. Now, most important is that Department of Family Welfare. India's largest concern was family planning. Family planning in the sense that India has a large population which is growing and growing. It needs to be stopped because somewhere or the other it is going to create, and it has begun to create problems of population overcrowding, the disease which are affected with the overcrowding, jobs, staying places and health programs, and of course the other programs. In fact, even with the population overgrowth, there is another problem which is coming in, that is in certain areas the sex ratio is being impeded. For example, in Punjab and Haryana today you have a large ratio of male and a less number of females, which is actually a skewed ratio, and this is not the thing which we want. So therefore, public welfare, Department of Family Welfare, Department of Family Planning has to be technically seen that where we should offer our services and what type of services we have to offer. So for that, this was of course created in 1966, implementation of programs concerning family welfare and MCH, and of course it has the following technical divisions, that is the program appraisal and special schemes, the technical operations, MCH, evaluation and intelligence. Now, why MCH? MCH should come because the moment a woman delivers, and if she has completed her quota of the normal family limit, we must make a motivational stop to the fact that she must control her family. And last of all, one of the most important in family welfare programs was the Nirod marketing. Now, today this has become a very modern marketing, and although when it was started, simple Nirod was being given to every primary health center and it was being distributed free. In fact, at that time, a lot of there was fun regarding this Nirod being used in and it was considered bad, and it was not a subject which was spoken of very frankly outside. But today, family planning is an open subject. Everybody knows about it. Even adolescents who are growing up, they know about family planning, which is in fact a good thing. Then most important, transport. Transport of items from the center to the periphery in time so that the program does not suffer. Then we have what is known as the Universal Immunization Program. Now, with all these programs, immunization of under 5, immunization of mothers at the right time is an important aspect which must be taken up, and therefore similarly transport and provision of the immunization material and for universal health care has to be seen to properly. And you have the area project. Most important, mass education and media. If you put a condom some 20 years back, if you had put a condom in front of a person, he probably wouldn't know what to do about it. Today, mass education has made a very effective role, and today media is playing a very important role in giving the right perspective on family planning to each and every community person. Now, the most important offshoot of the system of medicine today, that is the Indian system of medicine and homeopathy. Now, this was established in 1995, and the main areas of its functioning were, of course, education, standardization of drugs, enhancement of availability of raw materials, research and development, information, education and communication, mainstreaming this Indian system of medicine and homeopathy into the healthcare. Because nowadays when you go to the primary health center or when you go to the community health centers, it is important to know that apart from the modern system of medicine, you have one small section of Indian system of medicine and homeopathy in case people are wanting to take that particular type of medicine, and it should be there offered to them in the proper along with the proper mainstream medicines. Now, what are functions? Functions of all these health systems. General functions of this entire health system are, of course, surveys, which are very important to know the basic data from the community. So, we have planning, coordination, planning program, appraisal of all health matters in the country, and this can be only done through the surveys, which should be technically planned to collect appropriate data from the community. The specific functions are, of course, international health relations and quarantine. Let us not forget, India is definitely connected with the outside country, both through air as well as through sea. And therefore, international health relations and quarantine, people are moving from all over, people coming from Egypt, people coming from Africa, or people from India going to these others. We need quarantine, we need international vaccines, and we need control. Then we have most important control of drug standards. The Drugs Control Organization is headed by the drugs controller, and we have the medical store depots, and of course we have the postgraduate training programs. Now, postgraduate training programs are definitely conducted at the higher levels as well as in the medical colleges. Now, medical education, this is an important, because this is how you are creating doctors. These are the basic doctors who will go out to the periphery and who will look after your population for you. They are the ones who carry health and health care to the periphery. The central directorate is directly in charge of some of the medical colleges. Medical research organized largely through the Indian Council of Medical Research. Central government health schemes we have. Then we have the national health programs. For example, in the national health programs, you have health programs as eradication of malaria, control of leprosy, control of tuberculosis program. We have been able to eradicate guinea worm. We have been able to control filaria. Then we have the Central Health Education Bureau, and this prepares education material for creating health awareness amongst the people. And most important, health intelligence, that is the Central Bureau of Health Intelligence, and we have one national medical library to control. Now we have, of course, a Central Council of Health. Under this, we have the Union Health Minister, who is the chairman, and the state health ministers are the members. Now, the functions of this particular Central Health Council is to consider and recommend broad outlines of policy in regard to provision of remedial and preventive care, to make proposals for legislation in medical and public health, to make recommendations to the central government regarding distribution of available grants for health purposes to the states, to establish any organization for promoting and maintaining cooperation between the central and the state health administrations. And most important is the funding of healthcare. When budget is being made, it is estimated that we have to spend an approximate 5% of the GDP in 2030. The total healthcare spending in local currency was projected to rise at an annual rate of over 12% from an estimated $96.3 billion in 2013 to roughly $200 billion in 2018. While this rapid growth rate will reflect high inflation, it will also be driven by increasing public and private expenditures on health. And of course, this is roughly what is the setup at the central level, which we have already shown you. Now, in summary, it is important to summarize a few points. That is, the healthcare system constitutes the management sector. It operates in context of the socio-economic and the political framework. In India, it is represented by 5 major sectors of agencies. At the national level, the Ministry of Health and Family Welfare is there, the Directorate General of Health Services is there, and the Central Council of Health and Family Welfare. All these work together in order to give our country a good health coverage. The organization is the Union Ministry of Health and Family Welfare. The ministry has, of course, the 3 departments, that is the Departments of Health and Family Welfare, Department of Indian System of Medicine and Homeopathic, and most important, Department of Health Research. And each of these departments is headed by their respective secretaries. They have their own team of people. They are well supported by the technical wings in the center and by the research which is coming out. And the central level is mostly in to end it, healthcare delivery system is very important, and in this, what we need to know is how healthcare has been actually given right from the center to the periphery. And we know that in every single wing, every single department plays an important role in giving base to the structure of healthcare for our country. So, thank you very much and enjoy.